Welcome to Podcasts on Demand, a continuing medical education activity. This activity includes the most recent and current clinical data presented by leading experts. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the podcast description that can direct you to this information.
Welcome to today's episode of our podcast series, Ask the Expert, Emerging Evidence to Improve Outcomes in Vitiligo. My name is Dr. Raj Chovatiya. I'm a clinical associate professor at the Rosalind University, Chicago Medical School, and founder and director of the Center for Medical Dermatology and Immunology Research in Chicago, Illinois. My clinical and research focus includes the intersection of cutaneous immunology and inflammatory disease. Today, we're talking about a topic that's very close to my heart: personalized care in the treatment of vitiligo. The title of our first episode is Personalized Care, Treating Individuals with Vitiligo. Together, we'll explore why personalized treatment is so critical for managing this complex condition and how emerging therapies are providing hope for patients. I'm joined by one of my patients, Casey, who's been kind enough to share his personal journey with vitiligo. For a little background, vitiligo is an autoimmune disorder where the immune system mistakenly attacks melanocytes, the pigment-producing cells in the skin, resulting in white or depigmented patches. This can affect not only the physical appearance, but also emotional well-being. It's estimated that vitiligo affects approximately 2% of the world's population. However, what many people may not realize is that the condition can vary widely from one person to another. Some patients may experience slow progression of the disease, while others may notice rapid changes. To give our listeners a bit more context, vitiligo can manifest in various forms. The most common type predominantly is non-segmental vitiligo, which typically results in symmetric patches. In contrast, segmental vitiligo, which is usually much less common, usually appears in a more localized area and may develop rapidly. Understanding these differences is essential when tailoring treatment options. So, Casey, let's get started by discussing your experience with vitiligo. What was it like when you were first diagnosed?
Hi, Dr. Raj. Thanks for inviting me to join you on this podcast. When I was first diagnosed with vitiligo, I was about 19 years old. And when I first noticed the white patches on my skin, I felt a lot of fear and confusion about them. I wasn't sure why they were starting or even what the repercussions of them appearing on my skin would be. I first started noticing it on my face and then other parts of my body as I was getting older into like my early 20s. And I was worried about how it would spread throughout my young adult life and if there would even be any treatment for it and what treatments would actually work for me.
You know, that's something I hear from so many patients. The emotional toll that you shared with us can often be as challenging as the physical symptoms. Some common situations that my patients tell me about include isolation, stigmatization, even this thought about social perceptions, because oftentimes skin is really our mirror and reflection to the world, and individuals can equate appearance with self-worth. And so a lot of folks with vitiligo report feeling anxious and depressed. There's a lot of mental health symptoms in this population, and this can actually significantly affect quality of life. There's one study in particular that comes to mind that showed that individuals with vitiligo are actually at increased risk of developing anxiety and depression, with prevalence rates that have been reported as high as 30%. And so this really underscores the importance of addressing the emotional aspects and really the totality of the patient alongside the physical symptoms of the condition. So with that in mind, Casey, maybe you can share a little bit more about your story. When you first came to me, can you talk a little bit about some of the treatment options that you'd explored and what your experience was and how that impacted you overall?
Sure. I first tried to get treatment at about 19 years old, and at that point, I was prescribed a steroid cream, and I was only on it for a certain amount of time. It was primarily causing acne on my face. It was like painful acne, and so I stopped taking it primarily for that reason, and then also um, being young and no longer on my family's insurance, it became unaffordable for me at that time. I will say facing this at an early age, it did cause a lot of anxiety for me. I had a lot of body image issues growing up. I was self-conscious about these spots. Um, and then honestly, I gave up on treatment for probably about a decade. And then a few years ago, I started noticing more spots occurring on my body and in new places. And that's when I decided to look into other options for treatment. And when I came to you, Dr. Raj, and started looking into JAK inhibitors.
Yeah, that's really powerful, and thanks for talking about your story. You know, that frustration and some of the initial feelings folks have about their entry into therapy is very, very common. You know, vitiligo is such a complex condition with an autoimmune component. We know that no patient's really going to respond the same way twice, and it's the reason why we really try to take an individualized approach. And in your example, it was very clear that there was limitations to where you were going to even get with your treatment if you're able to stick with it, just because of some of the side effects and adverse events that you were experiencing as well. And you know, you shared some of your struggles earlier on with previous treatments with us, and you mentioned that we kind of talked about trying to take a slightly different approach. And you know, what was your reaction, I guess, when we first started talking about how there might be other treatment options, potentially something different than a topical corticosteroid for you?
Yeah, at first, I wasn't sure how it would work for me, especially given that I've had vitiligo for so many years now. Um, I I'm mostly trying to stay optimistic about the process, and as I continue to apply the cream, um, my I guess some of my fears was side effects of it. Um, Yeah, I guess making sure that, I know it's a slow progression, so for recovery, so I just want to make sure that the cream can work over time.
Yeah, I hear it. And I really personalizing treatment is really all about creating a plan that works for somebody, you know, not just medically, but practically speaking as well. And in your case, you know, I talked a little bit about some of the treatment options that we have. You talked about some of your traditional topical therapies. We talked about some of our newer ones. One of the approaches that I did mention was phototherapy. Remind me, Casey, is that one that you have ever done before for your vitiligo?
No, I've not done phototherapy at this point.
Yeah, and you know, I think that this really highlights an important feature of the disease itself. Whether you're thinking about topical steroidal therapy, advanced non-steroidal topical therapy, phototherapy, combination therein, it's an important point to realize that not everything is going to work for every patient. For some people, it's feasible to consider a cream that they can use every day. For others, that might be a little challenging. For some people, phototherapy that they could go to 3 times a week is doable. For others, the fact that they physically have to go somewhere multiple times a week, even if it has the opportunity for being effective, is really just very difficult given on work, school, life, etc. And so this was the type of conversation that I like to have with all of my patients like Casey to make sure that we can match the right treatment with the right patient and the right protocol, because at the end of the day, even the best treatment in the world that is just impossible to use for somebody's life is not going to be one that's very practically easy to adhere to. So during our time together, we ended up discussing treatment options, and we decided to focus on the topical JAK inhibitor, a JAK inhibitor spelled JAK, JAK inhibitor, Janus kinase inhibitor, ruxolitinib, to enhance repigmentation. I think this is a really nice place to take a bit of a side and just talk about JAK inhibitors a little bit as a mechanistic class for therapy. So, really, we think about these small molecules as a newer class of medication that blocks the Janus kinase or JAK signaling pathway. And I'll spell that for everyone out there, JAK. This pathway is involved in the inflammatory process that leads to the destruction of melanocytes in vitiligo. So, by targeting this pathway, these medications called JAK inhibitors can help stop the immune system from attacking the pigment producing cells. And this can allow for stabilization of the condition and even repigmentation. And historically, this has always been a challenge with vitiligo therapy because we have two steps we need to accomplish, not just one, but two. We have to stabilize the condition and stop the inflammation, and then create a situation where we can really stimulate repigmentation as well. So in clinical trials, ruxolitinib cream demonstrated quite promising results, particularly in stabilizing the disease and promoting repigmentation, especially in some of those challenging and very, very important quality of life burdensome areas like the face, but also the hands, the scalp, and others. In the pivotal phase 3 trials, which includes TRuE-V1 and TRuE-V2, patients treated with ruxolitinib cream experienced significant improvements in what was known as the Vitiligo Area Severity Index, or the VASI score. This is a tool that we use in clinical trials that takes into account the areas of the body that have vitiligo, how much depigmentation there is, and the relative surface area. So it's a composite tool that really calculates all of these things together. So for example, a good chunk of people showed improvement of at least 75% or more in the facial VASI score at 24 weeks compared to those using a vehicle cream with no medication. This was the primary endpoint for the study. So in TRuE-V1, approximately about 30% of patients, or around a third, receiving ruxolitinib cream achieved this level of response compared to really only about 7% in the vehicle group. Similar results were observed in TRuE-V2, showing that we had two studies with very, very similar results showing efficacy of ruxolitinib in promoting facial repigmentation. Additionally, ruxolitinib has also been very effective in patients with more extensive disease. And so there's been additional sub-analyses of patients with higher body surface area involvement. They've also had meaningful repigmentation as well, and improvement in quality of life and overall reduction in some of that stigma-associated visible skin change as well. Now, you heard Casey really very nicely bring up that sometimes it's not always about how well a treatment is going to work, but we want to think about the safety that goes alongside with anything that we do as well. It's always a two-part discussion when you're having that talk with your healthcare provider. And so the safety profile of ruxolitinib cream was generally very well tolerated. The most common adverse effects were mild and localized, and this included application site reactions. And then beyond that, actually very, very well tolerated. And so this showed that ruxolitinib could be a viable first-line treatment option for patients with vitiligo, offering both efficacy and safety as well. And so since its approval, this has really led to a lot of optimism in the dermatology community and those of us that treat a lot of vitiligo. And similar agents have represented a big advancement in our ability to treat diseases that otherwise we had a lot of limitations. And so, in this particular case with Casey, we introduced this JAK inhibitor cream, ruxolitinib, to really try to help him get control of the signs and symptoms of his disease, especially in areas that are highly visible. And, I think it's important to note that expectations are really important to set with this particular medication. And, Casey can talk about his own experience because I want to hear it in his own words. And we're kind of earlier on in the process in terms of therapy, but maybe you can tell us a little bit about what it's been like since we made that decision to start therapy together.
Sure. I've been using the ruxolitinib cream for about 4 to 6 weeks now. And well, I'm sure that's too early to have any visible differences. I will speak to the fact that I've thankfully not had any side effects with the cream. I've been taking it in the morning, typically after I exercise and shower, and then I apply it right before bed as well. And I think, I'm thankful that I haven't had any symptoms or side effects with it so far, and I think that that's helped at least boost my confidence in that I can at least try taking this cream for an extended period of time to hopefully see results.
That's great to hear. And, really monitoring the effectiveness of treatments are important because with the way that skin biology is, like I mentioned before, we're stopping inflammation, we're helping pigment come back. It's never going to be a extremely rapid and turnaround process. And so I think it's really important that you just have touch points with your patients, for those of you guys that are healthcare providers out there, to really make sure you can see what's going on, give additional support if needed, and adjust the plan if we have to. And it's really important that patients feel that they have a place to get the counseling as well. And one of the most important ones that you've heard about, both from my perspective and Casey's patient perspective, is communication about timing in which you might expect to see changes. And so, for instance, when you're seeing some of the first signs of improvement, Typically this was really starting to statistically happen within about a few months. So about the first couple months in terms of the trials itself. Patients may even experience better results the longer that they're on therapy as well. In fact, results from the pivotal phase 3 study showed that over half of patients who initially had limited or no facial repigmentation at week 24 actually achieved that 75% or more repigmentation after continued treatment up to week 104, suggesting that sometimes even earlier time points are not actually really reflective of where people might get. And so as we've learned from, other treatment interventions, in general, even going beyond a year, sometimes it's required to really have meaningful conclusions about results. So among patients who had, let's say, no initial facial repigmentation at week 24 in the topical ruxolitinib trials, there was improvements actually observed by nearly 8 out of 10 patients at week 52, and this increased to almost about 97% by week 104. And even for those with limited body repigmentation, there was significant improvements with over 81% having enhancements in their body VASI score at similar follow-up intervals as well. Patient safety is also a priority here too. And the great news is with this longitudinal treatment that we followed through in terms of the clinical trials and with real world data, it's given us confidence for continued use. There haven't been any adverse or unexpected adverse events in the long run phase, and anything that would be really worrisome hasn't really been picked up. And kind of as I mentioned before, remember, it's important that personalized care is more about just one particular treatment. Anyone listening today has heard one story of one patient, and that may not be reflective of every patient you hear based on the choice of agent, the combination of agents, the frequency of use. And the fact that we've made advancements now, I think gets us closer to a place where at least we have a gold standard that we can really work towards in terms of our patients when thinking about treatment itself. But I want to actually take a step back for a moment and think about kind of the emotional component of vitiligo. And Casey talked a little bit about some of his struggles earlier on. And, does it feel like you have maybe more of a role in your treatment now than you did before, in part because maybe you understand the disease and you understand the treatment? And does that kind of give you a little more confidence over your emotions?
Yes, I will say so. I think that being able to have a solution like the ruxolitinib now in the past few years has definitely given me confidence in not only possibly a solution, but also in that the healthcare industry is still researching and looking into vitiligo and treatments for it, and that it's not something that has been forgotten about, or because it's not necessarily a physically debilitating illness or a disease that it does have an emotional toll. And so I think the fact that there's still research going into it has given me confidence that solutions are being explored, and it's helped with my anxiety and at least continuing to pursue different treatment options.
That's great to hear, and I think that it's really this type of partnership that's so important and what we aim for when we're creating treatment plans and trying to really treat conditions like vitiligo that can be as emotionally taxing as Casey was really nice enough to share. And so I know that in my clinical setup, it's really important for me to make sure there's an environment where my patients feel comfortable to ask questions, learn more about the disease itself, learn about the treatments, and understand why a particular treatment might be the right choice. And it's such an important takeaway to hear Casey talking about the fact that there still is continued interest and commitment in terms of really trying to figure out how we can best treat patients with vitiligo, understanding that oftentimes it gets subsetted compared to other diseases because it may not be physically debilitating, but we know that the emotional and quality of life burden is profound to our patients itself. And on that note of really what's happening in the field, there's a lot of new treatments on the horizon and rapid advancement of therapies in dermatology in general. So in addition to topical JAK inhibitors like ruxolitinib, there's actually oral JAK inhibitors that are being studied in clinical trials. Upadacitinib and ritlecitinib and povorcitinib are three that are actually in the midst of phase 2 going into phase 3 trials. And these have shown great promise in preliminary studies based on the way that ruxolitinib works, and for these oral agents, particularly might be helpful with individuals who have far more extensive disease as well. There's additional research going into combination therapies that pair JAK inhibitors with techniques like phototherapy, which could maybe enhance the effectiveness of repigmentation. There's even studies looking at biologic therapies, so injectable antibodies that can actually target some of the signals that are overactive. Does that sort of sound kind of pretty exciting to you, Casey? How do you feel about a lot of these advancements and some of the hope that they bring?
Yeah, it gives me confidence in that, even if the ruxolitinib doesn't work for me in the future, that by that time that there might be other solutions available or other treatment options that, we can continue to pursue. Um, I I will say that the communication's been great and working and collaborating with you on treatment options. There was probably a several year gap between my initial treatment and working with a dermatologist and then working with you, Dr. Raj. And there were things that was researching on my own and pursuing. But now that I have a professional in the field that I can consult with on should I even, try these diets online that I read about or not, or should I um, try these supplements or vitamins? I think I spent so much of my time in my 20s feeling like I didn't have anyone that I could communicate with about this or get any professional feedback on. And I think for one, it's uh, created a lot more communication about my own health and managing my own disease. But it's also given me um, more of a source of truth, if you will, on what's a viable treatment option.
I love that. And I think that's such a nice take home message that, communication, I think, really underlies a lot of how we empower ourselves in health. And it's been kind of an amazing journey that you've been on. And I'm privileged to sort of share that part with you. And your perseverance has really been amazing. And again, it's a testament to the fact that it's so important to really have that good therapeutic alliance. And I think that that's kind of my takeaway too, that remember, there's never going to be one single right option for every patient, but it's just a matter of making sure that you can put all the information, all the options on the table, have really good shared decision making. At the end of the day, come up with a relationship and a plan that's going to work well for everybody. So with that, thank you so much for joining us today, Casey, and for sharing your story. I hope our listeners take away the message that personalized care can really make a difference when it comes to managing vitiligo. For those listening, I encourage you to offer more personalized care. Don't settle for a one-size-fits-all approach. In our next episode, we'll be diving deeper into the concept of shared decision-making and how it plays a crucial role in managing vitiligo. Until then, stay informed and stay empowered. Thank you for listening.
We hope you found this podcast useful and educational. To receive continuing education credit and to download your printable certificate, please go to the activity page at practice.cme.com to complete the post-test and evaluation to receive continuing education credit.